talk to you guys about chiropractic. I've been a chiropractor for 16 years. A little bit about myself. I was 12 when I came to this country, and I am Persian. I'm from Iran, and I've been here. Actually, I first went to Texas, so I graduated high school in Texas, and then moved out to California, and I've been here ever since. And I've been a chiropractor for 16 years, and prior to chiropractic, I've got multiple degrees in other things. I was going to go to law school, and that didn't. I did an internship, and I'm so glad I did. I hated it. It's like, I don't think this is me at all. So I switched gears and went into chiropractic, and when chiropractic happened, it actually was such a great thing. And it was so in alignment with who I actually am and was, but didn't know it. You know, you're younger, you don't necessarily know who you are all the time, but it was very much in alignment with me. Chiropractic has been around for an extremely long time, even though it didn't have the name chiropractic. And it is it's in historical books as far back as 3,000 years ago, and even the father of modern medicine, he talked about chiropractic as far back as 2700 BC, and he talked about it and the importance of taking care of the spine, and he in fact said that the spine is the gateway to your overall health, and it was so just profound for that time frame, and he was so ahead of his time. And with all the modern studies that have been done on chiropractic, it is just so true, and I'll share that with you a little bit later on. But chiropractic basically means working with your hands. I don't prescribe medications, I don't inject you with anything. It's all holistic, it's all done by hand, and it really works amazingly. And officially, it's been around for 125 years now, and it started back in Iowa by a chiropractor, by a wonderful chiropractor. And he actually had a patient, wasn't his patient, but he was the janitor of the school that he was teaching at. And the janitor was deaf in one ear, the right ear. And so he was experimenting with adjustments and how that's going to affect the overall health of the body. And so he really used the janitor as a guinea pig, but it turned out to be a wonderful experiment. And he adjusted him in his cervical spine, and instantly he got his hearing back in his right ear, like instantly. And so he knew he was onto something, and he did more and more, and the word got out at that time, and people were like coming in droves from all over the country to see this doctor who was able to perform this amazing miracle. And so the beginning of chiropractic was all about holistic health and overall body, and later on, with medicine getting in the way, they started boxing us into just back pain, neck pain, whereas chiropractic started out with holistic, whole body healthcare. And so a true chiropractor is really all about that. So I always push prevention and maintenance for that reason, but I'll go over it in more detail just so you understand. The spine, just like any other part of your body, is controlled by your nervous system. Your nervous system takes care of every single function of your body, down to the tiniest cells and their functions. So if your nervous system isn't working properly, then your body isn't working properly. Your body's malfunctioning, just as your nervous system is malfunctioning. So my job is to find the cause of whatever it is that's bothering you and treat the cause and not the effect. Whereas in Western medicine, it's all about treating the effect and not the cause. So we're always band-aiding things with, ibuprofens and injections and whatever, you name it. And I'm not bashing those things at all. I'm just saying that there is other ways of taking care of things that won't be so harmful to the overall system of the body. And chiropractic is one way to do that. Another important thing to know is that your posture affects every single bodily function. And it straightens up right away. Your posture actually moderates every physiological function and breathing and hormonal function and hormonal production of your body. And that was actually a study that was done by the medical community themselves, and it was published in the American Journal of Pain Management. and it was a huge, big deal when it came out. So posture is a big deal, and these days I see, unfortunately, it's part of my job, so I'm always looking at people. I don't comment, but I look at people and the way they walk and the way they're sitting and everything that they're doing, and especially little kids these days, because we're in such a society of this constantly, and kids are developing bad posture at an earlier age, and it's leading to a lot of problems. So I hope that parents will be aware of that as they're going about their life. Anyway, chiropractic is just an awesome thing, and if you really knew what it can do for the overall health of the body, I think people would understand how important it is to actually take care of their spine. I handed one of these out and put it in front of you guys so we can go through it together, but essentially what it is talking about the overall health of your body and how the spine is the gateway to your health. So it's actually the spine divided into separate segments, and it has the cervical, the thoracic, the upper back, which is part of your thoracic, and then the lower back and sacral. And out of every single one of those segments come out two nerves, and these nerves go to wherever it is they're going, and they supply your body with every single function that it needs to in order to do its job. So if you look at, for example, the first box, and the first box says C1 through C3. That means segments, cervical segments 1, 2, and 3. So it's just telling you that those nerves, the nerves that come out of those segments, those 3 segments, they supply basically everything that you see up here. So if they're out of alignment and they're not working properly, and your nervous system, your nerves aren't able to send those messages properly to wherever it is that they're going to, then you can expect to see things like headaches and migraines and tension and pressure behind the eye, blurring of vision, dizziness, lightheadedness. Those are just some of the things. Nasal congestion, sinus problems, childhood fevers, malaise, which is just general, achiness, and depression, etc., etc. So then it keeps breaking it down for you, and it goes by segment to segment. So when we move down another box and we see segments C4 through C7, which are cervicals 4 through 7, you're still in the neck, we're still in the neck. You can expect to see things like pain and stiffness in the neck, pain in the shoulders, arms and hands, numbness and tingling in your hands or fingers, bursitis, muscle issues, nervousness, neck tension, chest pain. God, it just goes on and on and on. And I have seen it myself in 16 years that I've worked as a chiropractor. People don't come to me and say, oh yes, by the way, I have, I have high blood pressure, or they don't come and say, I've got, you're all eating. They don't come and say, I've got constipation. They don't say things like that. They say, I've got, just achiness, I've got neck pain, I've got back pain, I have numbness and tingling, I have burning pain in my feet, sciatic, things like that. Those are the things they come in with. But the wonderful result of, or the side result of what I do with them once I start treatment is that they all of a sudden start feeling all these other amazing effects in their body, and they don't even attribute that to chiropractic at all, but they'll tell me, oh my God, I just went to my doctor and he took my blood pressure and I'm actually down by da. And that's because I'm adjusting them during the time that they're coming in for treatment. I'm adjusting their spine, and by adjusting their spine, I'm really adjusting their nervous system. I'm really helping their nervous system function more efficiently. That's all. So the way I describe it usually is, when the bones in the spine are out of alignment and they're sitting on nerve, they're choking a nerve, and the nerve isn't really able to do what it does. It's a little bit of a, just to give you a visual or understanding of what it's like. Imagine like there's a hose in your garden, and the hose, water comes out of the hose, and you turn on the water and you put your foot on the hose. That water pressure keeps building back there, right behind where the foot is. And then the water isn't really coming out to the garden the way it should. It's still coming out at the other end. It's still watering your garden, but it's not doing it at the rate that it would if you were to take your feet off the hose. So it's the same thing with the nervous system and the nerves, because we're talking about really small area with just the tiniest structures. And even the study that they did is as little as a dime. If you have a dime and you put that dime on the palm of your hand, the weight of that dime is all it takes That's the amount of pressure it takes for the nervous system to actually malfunction. That's how little we're talking about. And so we just kind of go about our business doing that thing, not realizing how important taking care of the spine is. So when I do my commercials as well, I always talk about adjusting children, and it's really important to adjust children in particular because they're always active, they're always falling, they're always hitting, they're always bumping, they're always bruising, they're always doing something because they're kids and that's what kids do. But to make sure that you take them to the chiropractor, make sure that you are taking care of those bumps and hits and everything else and falling on their heads, it's really important at an early age because when we don't, they continue to kind of fester, and then they become a bigger problem later on. And I have parents that come into the practice and they're all holistic, and they bring the children with them, and we adjust the children as well, which I love because they're so awesome. And the children have like nasal congestion, they have like earaches, they have crankiness, they have all these different things that go on, and when they get adjusted, it's such an instant result. You actually see that instantly. You see the change because they don't have all the years of build up gunk like we do. So they respond really much faster to chiropractic than maybe an adult would. But that's the reason why I adjust children as well, just for their entire holistic health. And it's just an alternative to the drugs and the antibiotics that end up killing all the good bacteria in their body as well. And then they are susceptible to more because their immune system is down because of all the antibiotics. So it's just a holistic way of keeping them healthy without all that extra external things. I also adjust pregnant women who are having back pain during pregnancy, which is actually really common as they grow and develop and the baby grows and develops. So it's a wonderful way to take care of them as well during pregnancy. And also studies show that the more they get adjusted regularly during their pregnancy, the easier time that they will have with the childbirth itself. Does that mean it's time for questions? Okay, so questions.
You have 3 minutes.
Sure.
Whatever, however you want to use it.
Ask away. Anybody, any questions? You want me to just continue talking? Yes.
My husband has a problem, C1, C3, and he broke his back many years ago. About every 10 years we go in for surgery, and every 10 years they come in for something new, so we've kept him out of the spinal cave. He's been able to fix it. He's starting to have troubles now, and surgery's probably next. Would coming to a chiropractor like yourself ease that up for a while so we can put it off a bit?
It depends, yes. It depends on what it is and how much damage there is from prior and what he looks like, what his spine looks like at this point, how old he is, all these different things. But having said that, my technique, the particular technique that I use that Florence has also seen, it's extremely low force. So I would say it's probably even more non-force than any other technique out there as far as chiropractic is concerned. And it's very good for post-surgical issues or trying to prevent. Yes, I have a patient, I'm sure not as, she's a younger gal, but I have already helped her twice to get out of surgery. So chiropractic can work, but it's the type of chiropractic that's more important. It's not all chiropractic. It just depends. And it depends on the patient and their age and that's so many different factors. So I wouldn't be able to give you an exact until I saw what was actually going on. Yeah. Yes?
Years ago, my chiropractor, I've been for a while, shame on me, but he had other tools he used in his office, like this table that would drop your neck down. I'd see people on different machines and their head put back with these balls on it. Do you do those what are those type of things?
Those are just physiotherapy stuff that he would add to the adjustment itself.
Okay.
I don't have, I do have some gadgets and I will work with those as well. It just depends on the patient. I'm more of, I use my hands and I can feel things and I know exactly what I'm looking for, but I always at the same time send out for x-rays and MRIs if I need to. I don't just blindly go in, and I don't advocate that at all. That's my tool. X-ray is my tool to see what their spine looks like at the age that they're at. So I don't want to go in blindly and just do whatever I've got to do. So I do take x-rays. I do send out things like that, just so I can see exactly what's going on. But yes, I do have gadgets as well that I'll use if I need to. Yeah.
Okay, is chiropractic care physically covered by insurance?
Is it covered by
By
insurance?
insurance, yeah.
Nothing is covered by insurance anymore. So that's a nutshell of a question, you know, that's your answer. No, and Obamacare, as a matter of fact, we don't know where the heck Obamacare is gonna go, but it does not cover chiropractic at all. Medi-Cal doesn't cover chiropractic. Medicare barely covers chiropractic.
But you know, any other PPO insurances?
Some of them,
Yeah, some
they don't. And so I think the more people realize that we are in an age where we are responsible for our own health and we need to take care of it ourselves versus somebody else paying for it, because insurance companies just are not in the business of paying for yourself. They're in the business of taking your money. And they're very good at that. So I would say not really. And more and more patients are coming in without insurance, and we just have to deal with that. So, yeah.
Okay.
Good.
Thank you.
Thank you.